Welcome back to another Explainer. Today, we're diving into a story that honestly plays out like a high-stakes cinematic thriller. I'm talking about a stealthy villain, a devastating infiltration, and an absolutely brilliant medical counterattack. We're going to explore the malaria invasion, taking us on a truly incredible cellular journey. We aren't just looking at a simple mosquito bite here. We're tracking this parasite from the exact moment of a microscopic breach all the way up to our global prevention strategies. It's a fascinating narrative of survival, sabotage, and science. Let's get into it. Here's our roadmap for today's briefing. First, we'll cover the vector and transmission. Then we'll look at hijacking the host, detecting the parasite, clearing the infection, and finally, the ultimate goal, prevention. All right, Section 1, the vector and transmission. The initial infiltration. Okay, so before we plunge beneath the skin to see the damage on a cellular level, we actually have to start out in the macroscopic world. Picture this. It's a warm evening, there's a soft breeze, and you hear that faint, high-pitched buzz. It seems totally harmless, right? But it's actually the start of a highly coordinated biological attack. The whole invasion kicks off with Plasmodium sporozoites. These are these spindle-shaped microscopic parasites, and they're injected directly into the rushing human bloodstream by an infected female Anopheles mosquito. She lands, pierces the skin layers, and just delivers this payload right into your blood vessels. It is terrifyingly efficient. You see, malaria isn't just a disease like a common cold floating around. The second those sporozoites hit the blood, the host's body is officially under siege. It's an invasion by a living, moving entity with a very specific, highly destructive agenda. Which brings us to Section 2, hijacking the host, sabotage in the liver and blood. Once inside, this villain has a tactical plan to scale up its forces completely undetected. Look at the alarming speed of this timeline. At 0 minutes, you get the injection. Then, literally within minutes, the parasites seek refuge in the massive cells of the liver. Here, they multiply silently. The host feels absolutely nothing at this stage. Then, soon after, thousands of new parasites flood back out into the bloodstream. It's a total ambush. The invader actually uses the host's own infrastructure to build its army. Let's break down exactly how this hijack happens. Step 1. Those spindle-shaped sporozoites enter a liver cell and transform, multiplying into thousands of small, round cells called myrizoites. Step 2. These myrizoites burst out of the liver. And then, step 3, which is absolutely critical, they invade rushing red blood cells. They get inside and they cause those blood cells to swell up and violently rupture. When you hear about the severe fever and intense chills a malaria patient goes through, this is exactly what's happening. The physical, microscopic popping of millions of red blood cells throughout the entire body is what triggers those life-threatening symptoms. So, how do we fight back? Section 3, detecting the parasite, unmasking the invader in minutes. We're shifting now from the frantic environment of bursting blood cells into the clean, precise world of a medical lab, because defeating malaria always starts with finding it. Doctors can use microscopic analysis, where they take a tiny droplet of blood, place it on a glass slide, and look for the actual physical ring-stage parasites hiding inside the red blood cells. It's a direct visual confirmation. Or they can use a rapid diagnostic test, or RDT. This is basically high-tech biology inside a small plastic cassette. Apply the blood, and 2 distinct pink bands form if the infection is there. Whether through a microscope or the chemical reaction of an RDT, unmasking this villain is fast and incredibly accurate. Okay, Section 4, clearing the infection, the destruction of the parasites. This is where the story gets super hopeful, because malaria is highly treatable if we catch it. The answer? ACTs, or artemisinin-based combination therapies. These are incredibly powerful medications that use a specific molecule called artemisinin. It acts like a targeted medicinal strike. It actively seeks out those infectious malaria parasites inside the red blood cells and literally dissolves them at their most vulnerable stages. You take a pill from a blister pack, and you're essentially sending in a specialized molecular strike force to wipe out the invaders. The best part? It's swift, and it works perfectly. ACTs quickly clear the infection, entirely destroying the parasite's life cycle within the human host. The invasion halts, the fever breaks, and the patient recovers. It's truly a massive triumph of modern medicine. But we can't stop there. Section 5, the ultimate goal, prevention, building a fortress against return. Treating the disease after a breach is amazing, but true victory means making sure that mosquito never delivers its payload in the first place.
To build this fortress, we rely on three main pillars. First up, sleeping under insecticide-treated bed nets. These act as a physical shield draped over a bed that not only blocks the mosquito, but neutralizes it. Second, indoor spraying, which creates a defensive barrier right inside the home. And third, deploying groundbreaking vaccines. This releases protective antibodies directly into our blood vessels, internal shields ready to fight off the sporozoids the second they enter, long before they can ever reach the liver.
So, what does this all mean? It brings us to one profound realization. Prevention really is the ultimate cure. We have the tools to treat the disease, for sure. But if we break this cycle of transmission by stopping the mosquito vector altogether, we can eliminate malaria entirely. We aren't just winning the battle inside a single host, we're winning the global war.
I want to leave you with this question to chew on. With insecticide-treated nets, indoor spraying, and life-saving vaccines now at our disposal, how soon can we finally eliminate malaria for good? We've mapped the cellular journey, we know exactly how this villain operates, and we have the medical weaponry to stop it. The roadmap to eradication is clear. Thank you so much for joining me on this explainer. Keep learning, keep questioning, and I'll catch you on the next one.